The United States has two problems. We have healthcare costs that are too high, and we have, as a result of that, too many people without insurance. And our healthcare spending here in the United States is about twice any other country, about $7,000 a person, and we're not getting good bang for our buck. So the Affordable Care Act took a bold step in trying to control costs by adding 32 million newly insured individuals to the public program, paying through subsidized insurance, the opportunity to purchase insurance and hopefully lower costs in the long term. Small businesses need to understand that because of the scope of this legislation and how large it was, a lot of authority was delegated to the executive branch to craft critical details. In many ways it was a 2,000-page outline. So business owners need to understand that there's going to be some compliance things, particularly if they have more than 50 employees. If they have less than 25, they're probably not going to be impacted. However, there may be some opportunities to capitalize on some tax credits. But for the most part, I think this legislation is going to cost employers time, which many of them do not have right now. Figure out where you need to be on January 1st of 2013 and 2014 because there are going to be some compliance things. And a lot of the fines have yet to be determined, and so that could be problematic because for any business owner, going against the government getting fined can be a challenge. It's important to change health behavior of your workforce. The state of Nebraska, for example, spends $8 billion on chronic disease and about our GDP, and only $2 billion of that went to cost. The other $6 billion went to lost productivity from your workforce. So an unhealthy workforce is an unproductive workforce, and I think as business owners see the issue of healthcare costs continue to squeeze their bottom line, they're going to realize that they need to take an active role in managing the health of their employees.